Today we're going to talk about therapeutic communication. Our objectives today are to discuss therapeutic communication, the goals of therapeutic communication, what it is and what it is not. We will also discuss or define the proper communication techniques with an emphasis on active listening, when to use silence, and providing leads. Therapeutic communication is patient-centered communication. This is when the nurse helps the patient explore their thoughts, feelings, and express themselves. And also the nurse avoids barriers that will hinder therapeutic communication or that will take away the focus of the patient in the conversation. So the goal is to promote an understanding of the patient's feelings and to build a rapport and trust while maintaining professional boundaries. So what it is not, or non-therapeutic techniques. A nurse should never ask the question why to a patient. That will put the patient in the defensive mode and they will be unable to receive from you, and the establishment of trust and building rapport are sabotaged. You never want to give your opinion. Your opinion does not matter. False reassurance. You never want to give the patient false reassurance and explain to them everything will be okay, it will all work out. That is non-therapeutic and sometimes untrue. You never want to give closed-ended questions unless it's on a specific topic in an assessment, such as do you have pain, and then you can lead further with the other interview questions in reference to pain to gather that information. But closed-ended questions are non-therapeutic and usually are not beneficial because they give you a yes or no answer. So do you have pain? Yes or no. Changing the topic or avoiding a difficult topic is non-therapeutic. If the patient brings up a topic that you're uncomfortable with, just be there, be present, listen, allow them to express their thoughts. Minimizing the patient's thoughts and feelings is also non-therapeutic and will put the patient on a defense and they will be unable to receive from you. Judging a patient is non-therapeutic. Failing to remain patient-centered or focused is non-therapeutic. So the nurse should never refocus the conversation solely on them. There is a technique where you will share of self, but you will refocus back to the client immediately. Do not take over the conversation and explain your situation when the client is trying to share their personal feelings. There are several therapeutic techniques. Open-ended questions is when the nurse gives the patient a question that requires explanation. So can you tell me why you feel that way? And this will require the patient to take lead of the conversation and to express their feelings. Restating is repeating the patient's exact words. Reflecting is returning the focus to the patient's situation. Paraphrasing, restating what the patient said in their own words. This conveys an understanding of what was expressed to you. Exploring is gathering more information from the patient about what they may have mentioned, but not have went in depth about that particular topic. Focus questions collects data and encourages feedback. It also clarifies the patient's ideas. General leads. allows the patient to take the conversation and go where they desire. We do not want to influence their disclosure. Present reality, dispelling delusional beliefs, misconceptions, and hallucinations. Reorientating the patient to reality, basically. Offering of self, limit, limited self-disclosure with a quick return of the focus to the patient. So you never want to take the conversation and turn it into something that's totally about you, but you may want to share a brief history to say, I've been there and I'm here for you if in fact you need me, because I do have some understanding of how you're feeling. Nonverbal and verbal actions must be congruent. So you cannot say, I'm there with you, I broke my foot, I felt that pain, I felt that agony, I felt that debilitating, um, dependent state. But your actions show, your nonverbal actions show that you are frustrated with helping this patient every time she has to go to the bathroom, walk to the bathroom. So your verbal and your nonverbal must match. And there are 3 others that I will review on 3 other slides. These are very common use techniques. One is active listening, very important. Silence, which is important in certain situations, and providing leads. So we'll talk about them on the next few slides. Active listening is another therapeutic communication technique. SOLAR is an acronym that describes the proper way to apply this technique when interacting with your patients. So you want to always be at eye level. So the suggestion is to sit facing the client so that you are not standing above them and hovering over them, but you are at eye level with the client. You want to observe an open posture. You do not want to have your arms crossed, your legs crossed, and just appear to be unapproachable or resistant. You want to lean toward the client, and this shows that you are interested in what they are saying and that you are fully present. You want to make sure that you establish and maintain eye contact, which I believe I did mention the eye level, but I want you to maintain eye contact while they're speaking to you, unless there's some kind of cultural barrier there or the patient has some kind of deficit where they do not maintain eye contact with people, then you want to just discern that as well. And also you want to appear relaxed. You do not want to appear as if you are uncomfortable with this conversation or uncomfortable sitting with this patient at this time, as if you do not have time to listen. You want to be present, you want to be relaxed, and you want to be open, leaning toward them, looking at them, and listening actively to them. Silence is another therapeutic technique. So silence allows the patient to gather their thoughts, especially when they need to make an important decision. It also allows them the power to initiate the conversation or restart the conversation when they feel ready to. So be patient, be willing to wait, be willing to sit in silence. Never rush the patient to respond. In addition to, you want to remember it is very important during grief and loss could be the loss of a limb, it could be receiving a poor prognosis, it could be the possibility of death or something such as hospice, where there is no treatment available for the patient. So these are all considered possible loss or grief situations. So allow the silence to remain until the patient initiates the break in the silence. So please do remember that. And providing leads is also a therapeutic communication. It helps the client to verbalize their feelings and it steers the conversation. And it also indicates interest. So you do want to stay on topic and allow the client to stay on topic, almost like a tunnel vision. But you don't want to lead the conversation as into giving your opinion about how they should feel or what they should do. You just want to make sure if we're talking about this venous stasis ulcer, that we are on topic about things relevant to the venous stasis ulcer, and we're not talking about things that are not focused on the task at hand. Okay, hopefully that made sense. So let's discuss how we can put the therapeutic communication techniques we just learned to practice. First, I want to emphasize that open-ended questions are preferred and are very useful when you're interviewing your patient. So if you are taking an exam, you want to choose the answer that encourages your patient to converse or to have dialogue or to give you feedback more than a yes or no answer. So a yes or no answer is demanded by a closed-ended question, and that shuts down the conversation. So there are times when a yes or no question is appropriate, but oftentimes you want to get feedback from your patient. So what brought you here today? And so then the patient will proceed with explaining to you exactly what happened, how they're feeling, and you want to proceed along those lines and encourage more of their story to be disclosed. So open-ended questions are preferred when interviewing a patient. There is a time and a place for a closed-ended question that will require a yes or no. But ultimately, until we actually get their story, we want to encourage the conversation and give them open-ended questions. In the event that you give them a blank statement and you do not follow up with an open-ended question, that will shut down the conversation. There'll be nothing else for your patient to tell you or to explain. So you want to avoid just giving them direct statements, such as, oh, I need you to elevate your foot. There's nothing for them to say after that. But if you explain to them, I need you to elevate your foot, and then ask them how long the swelling has been going on in their ankle, then they can explain to you exactly how long it's been happening and maybe give you some details about when it began. I'll take a minute for any questions.